Hi, I am Dr. Sunil Dachepalli, Senior Orthopaedic, Robotic Joint Replacement and Arthroscopy surgeon who deals with sports medicine. Now, today the main question is about ACL ligament tears. We keep hearing that ACL ligament is a nasty one. If it's torn, everybody needs surgery. So that's what we are going to look into. So we'll see at different steps what is it and what are the types available and what happens if we don't do surgery. This is the ligament there. ఇప్పుడు మీరు చూస్తే ఇక్కడ లోపల లిగమెంట్ కనిపిస్తుంది కదా. దిస్ ఈజ్ ACL ligament that binds both the bones so that it doesn't rock. So this helps in regular movement of the knee joint. At the same time, it keeps your joint stable. So if this is torn, there is a chance of instability. So this is what we have to look at. Whenever there is a tear in the ligament, we have to see is it just ACL or the associated ligaments. So this is what we have to look and take care appropriately. Normally when you come to us, we do clinical examination and we see if there is any rocking motion in the knee. If we find it and suspect there is a ACL tear or any ligament tear, first and foremost we do is an X-ray. If there is nothing major on the X-ray, then we plan for MRI scan. ఇప్పుడు అందరికీ డౌట్ ఏమొస్తుందంటే ఈ ఎంఆర్ఐ స్కాన్ అవసరం లేకుండా ఉట్టి ఎక్స్రేలో చేయొచ్చా అని. ద ప్రాబ్లమ్ ఈజ్ ఆన్ ఎక్స్రే యూ సీ ఓన్లీ ద బోన్స్, వెరస్ ఎంఆర్ఐ స్కాన్ షోస్ ఆల్ ద డీటెయిల్స్. నా సజెషన్ మీ అందరికీ, ఇప్పుడు మీకు అనిపిస్తుంది ఈ డాక్టర్ అనవసరంగా టెస్టులు రాస్తున్నాడని. మీకు ఆ డాక్టర్ నచ్చకపోతే ఇంకో డాక్టర్ దగ్గరికి వెళ్ళి ఇంకో డాక్టర్ సెకండ్ ఒపీనియన్ తీసుకోవడం తప్పులేదు, కానీ మిమ్మల్ని మీరు శిక్షించుకోకండి. అండ్ ఇంకోటి ఇంపార్టెంట్, ఎంఆర్ఐ స్కాన్ రేడియేషన్ కాదు, అది గుర్తుపెట్టుకోండి. No, the first and foremost thing is when you come to us, we examine how much it is giving off. If it is significant grade and if there are associated ligaments also, first we give you a brace and give it some time. It can be up to 6 weeks also. We don't have to rush for surgery. This helps in healing of the other areas. Then we reassess. If it is healed, we don't have to. The chances of other ligaments healing is about 90%, whereas ACL healing is about only 20%. But at least at 6 weeks, we know that the rest are all healed. అప్పుడు మనకి ఏంటంటే ఓన్లీ ACL ఉంటుంది, దాన్ని ఒక్క ట్యాకిల్ చేస్తే సరిపోద్ది. సో ఇది పరిగెత్తి ఎమర్జెన్సీ ఆపరేషన్ కాదు. Some people come and say, I can't afford it. Some people say, do the best in the world. The beauty in India, especially at Yashoda hospitals, is we cater to everybody. We do with the least possible price to the utmost. So అందుకని మీరు భయపడాల్సిన అవసరం లేదు. You discuss the options with your doctors. Normally we take out the ligament from the back of the knee, that is called hamstrings, and we put either screw or bolts on top. These are made of titanium, so you don't have to worry about the MRI scan if required later. సో అందుకని మీరు భయపడకుండా డాక్టర్తో అన్ని ఆప్షన్స్ డిస్కస్ చేయండి. అలాంగ్ విత్ దాట్ వీ కెన్ స్ట్రెంగ్తెన్. ఇప్పుడు ఎట్లా అంటే మీరు బైక్ నడిపిస్తున్నారు, హెల్మెట్ ఉంటే జాగ్రత్త. అది అట్లనే ఇప్పుడు ACL సర్జరీ చేసినప్పుడు అప్పుడప్పుడు మీ లిగమెంట్ బాగా పల్చగా ఉంటుంది. సో టు రీఇన్ఫోర్స్ దాట్ వాట్ వీ డూ ఇస్ కాల్డ్ ఇంటర్నల్ బ్రేసింగ్. వీ యాడ్ అన్ ఎక్స్ట్రా synthetic ligament to that, and also we do the latest techniques called all inside. And also to prevent regular injuries of this, we add extra procedure to the side called LET. So I can confidently say once you have surgery with us, you can go to any part of the world and say we had this, and they will say this is the best they can do. So మీరు లండన్ వెళ్ళినా అమెరికా వెళ్ళినా ఇది దాటి ఎవరు చేయరు, ఎందుకంటే మేమందరం అక్కడ ట్రైన్ అయ్యి వచ్చాం కాబట్టి అక్కడ చేసేది కూడా మేమే. So you don't have to worry about the surgery. Now a lot of people are worried what is the recovery time. If you just have the ACL surgery, we make you walk the same day with full weight with either crutches or walker, and as you feel comfortable going to the washroom, doing a daily chores, we get you to ease off, use a stick or then take it off. This is only with the ligament surgery. Whereas if added, there is something called meniscus. If you see there, along with the ligament, we have the horizontal soft tissue called meniscus. If they are injured and if they repair that, I might have to ask you to put only half weight. This is to protect the healing. So it takes about 6 weeks and we give you a brace. If you are doing a desk-based job, you can go back to your work within 2 weeks. And after 6 weeks, we take out the brace and then start the actual physio, which is strengthening and full range of movement. The next question everybody asks is, can I straight away do everything? No. There is something called rehabilitation. What we do is, see, the surgery and the physiotherapy go hand in hand. Physiotherapy doesn't mean that you have to have a physiotherapist every day. They'll give you a schedule for 1 week. You do that. Then you go on to the next step. So if you do that, like let's suppose first week you're bending the knee, second week you're bending further, and 6 weeks after surgery we start strengthening the knee. అప్పుడు ఏమవుతుందంటే మీకు you rehabilitate and strengthen the joint at the same time so that it doesn't fail soon. Atla you keep on continuing. At the end of 1 year, you should be able to play football. So this is the main aim. Like I said, this ACL surgery is a very good procedure with 98% success rate. And if you follow our proper protocol of physiotherapy and rehabilitation, we expect you to go back to near normal. Please mark the words near normal, because everybody says, oh, it's not exactly like my other knee. No, it won't be. You will have a little bit of difference. Your brain slowly gets used to that. And you should be able to play football, golf, volleyball or rugby also. So if the most important thing what you should do is follow the rehabilitation protocol. Another common question, nakoddu sir naku operation ante bayamu, I don't want to do the surgery. Well, it's your choice. Nobody forces you to have a surgery. But what you should remember is, as you're walking, instead of the knee having a nice symmetric movement, it'll rock every time. So what happens, this cartilage there slowly wears out. Within 15 years, your knee joint will be like this with completely worn out cartilage. Then you might have to undergo a total knee replacement at a very young age. Because at that time, when it is completely worn out, you will find it difficult even to walk. So my suggestion is, please select a good surgeon who has lots of experience in this surgery, but please don't trouble yourself. That will lead to further problems. All the best.